Good afternoon, everyone. Thanks very much for joining us on the news briefing for today. We're very pleased today to start with our COVID-19 information and update. And we have Christy Mishi, who's the Assistant Director of Public Health, here to tell us what's happening. Good afternoon, Christy.
Good afternoon. Thank you for having me today and for putting up with me while Dr. Moreno is out of the office. Just wanted to start before we jump into some questions. I'll give you a brief overview of what's really happening in Monterey County. We're in a really good place. All of our numbers and our surveillance metrics are pointing in the right direction. Our case rates are dropping. We're at about 33 cases per 100,000 population, and that's a 7-day average with a 7-day lag to let our data settle a little bit. Our test positivity is just below 10%. Ideally, I'd like to see it down under 5%, but again, it's a lot better than we were a few weeks ago. We only have currently 47 people in the hospital in Monterey County who test positive for COVID-19, and that's a really sharp decline as well. So again, all of our metrics about transmission of COVID-19 are headed in the right direction. Our vaccination status, we continue to vaccinate across Monterey County. The Public Health Bureau and other vaccinating agencies offer clinics 2 to 3 times a week around the county. We're currently sitting at 69% of our population is fully vaccinated. And when you reduce that down to just the eligible population, that's about 74% of our eligible population is fully vaccinated. Our booster, we continue to offer booster doses. Booster uptick has been highest in the 65 and older population, with about 77% of our seniors 65 and older having received a booster. Just a quick update on variants. We continue to see primarily Omicron variant here in Monterey County. Our whole genome sequencing that we've conducted in our public health lab has been predominantly Omicron since mid-January, and that's primarily the BA.1 variant of Omicron. And I think, Maya, I'll stop there and see if anybody has any questions.
Great. Thank you very much for that brief update. And I do have one question now. If anyone has any other questions for Christy, please go ahead and start putting them in chat and I will ask them. So your first question, Christy, can you explain how deaths are a lagging indicator as they continue to rise? So
really what happens over the course of illness in many people is that people get infected with COVID-19, they show symptoms a few days later, their symptoms worsen. We've seen a pattern where symptoms tend to really worsen around day 10 of illness. People typically then present to the hospital. They receive excellent care here in Monterey County, but it's sometimes that is a prolonged course where sometimes people can spend a couple of weeks in the hospital and then unfortunately expire. So it takes that data is not as immediate as we see with when somebody's tested. We should get that data within 24 hours. But unfortunately, deaths sometimes take a while to evolve. And then, of course, there's a process of cleaning the data, reviewing medical records, and making sure that the death is attributable to COVID-19. And that's why we kind of consider that deaths are more of a lagging indicator.
Thank you for that. Next question, are COVID face masks emotionally harmful to some young children? And if so, how?
Well, I think their mask wearing is relatively new to the United States, but it's been very common around the world, particularly in other cultures. We've seen about a year of mask wearing among children. And I think in some ways, children adjust better than adults. There aren't any studies that I am aware of that show that mask wearing is emotionally harmful to children. Children are fairly resilient. And what we do know, though, is children are susceptible to COVID-19, and they can pass COVID-19 on to others. So mask wearing among those who are 2 years and up has reduced transmission of COVID-19 in our communities, in our schools, in our everyday life as we go about our activities.
Thank you. Next question. What percentage of samples are being sequenced to determine variants?
That's a good question. I don't have an exact number for you, but it is a very small percentage of the specimens. I would say probably somewhere around 3 to 5% in Monterey County. So a very small number, but it does give us a picture into what we think is circulating in our community. It seems to be locally, we're pretty reflective of what's happening statewide. It's not a perfect sample, but it does give us an idea of what's circulating.
Thank you. Next question. Has the BA.2 variant been detected in Monterey County?
We have not detected any BA.2 lineages here in Monterey County. Our whole genome sequencing program here in Monterey County and our public health lab can detect it, but so far among the specimens we've sequenced, it has not been identified.
Thank you. Next question. As case counts continue to drop, what message do you want to send out to help keep people in Monterey County safe from COVID-19?
So vaccines remain one of our most important tools against COVID-19, and getting as many people vaccinated as quickly as possible can help us sustain the declines that we're seeing here in Monterey County, but more importantly, increases in vaccinations here locally in the US and globally can help prevent the emergence of new variants of COVID-19. So that's not only going to help us in the short term to keep our case rates and trends going the right direction, but it's going to help us from having more variants like Omicron develop in the future.
Thank you. Next question. Do you think it's important for younger people to get vaccinated?
Absolutely. I mean, we have seen some children being really affected by COVID-19. We've seen children hospitalized. Unfortunately, we've seen children pass away from COVID-19, and we really don't have a good understanding of how the long-term effects of COVID-19 in children. So I think in order to keep our kids safe and to keep our schools open, vaccination of young children is really important.
Thank you. Next question. Why do you think the test positivity rate in Monterey County is higher than the statewide rate?
Well, I think that we have a little bit higher transmission here. We have seen over the course of the pandemic that Monterey County lags about 2 weeks behind the state. So we actually started on our uphill part of the surge about 2 weeks behind the state. And now as we are on the downhill side, we see that same trend continue. So I think we'll catch up. We're just a little bit behind.
All right, thank you. That's all the questions that I have right now. Are there any other additional questions for Christy before we move on to some of our other topics? Giving a little typing time in case. No other questions for you today, Christy. Thanks very much for dropping in today and giving us a COVID update.
Thank you.
All right, before we move on to our next topic, I want to take a minute to introduce you all to somebody. You may be aware we have a new county communications director for Monterey County, and I want to take this opportunity to introduce you to Nick Pasculi, who some of you may know, but here's a chance for you to say hello to our new communications director and have him say hello to you. Good afternoon, Nick.
Hello, everybody, and thanks, Maya, for that introduction. Really happy to be here with you all, and I look forward to working with you. As you all know, I just started last week, and there's a tremendous amount of learning to do. I'm on a treadmill for sure, and enjoying what I'm learning and the people, a lot of tremendous people here at the county, and I'm just excited to be here, and I look forward to having an opportunity to work with you all as we move forward and go forward with these, what I think are tremendous press briefings that Maya has put together. So my welcome to you and hello to you all.
Thanks very much. And boy, you guys will have plenty of time to talk to Nick about a lot of things in the years to come. All right, so let's move on to our next topic. As many of you know, Monterey County has experienced many disasters of all kinds. And learning from these disasters really helps us break the cycle of disaster recovery and repeat. So Laura Emmons from our Office of Emergency Services is here to talk about a hazard mitigation plan that is going to help us with being better prepared and breaking that disaster cycle. Good afternoon, Laura.
Good afternoon. Thank you. That was a great introduction to the hazard mitigation plan, which I am excited to announce that our 2022 update is now available for public review. And this is a comprehensive update to our 2016 multi-jurisdictional hazard mitigation plan. And it includes all 12 incorporated jurisdictions in the county, along with 4 special districts. And really the goal of this plan and hazard mitigation in general is to reduce the risk to life and property in Monterey County in really an efficient and effective manner by decreasing long-term vulnerabilities to hazards and then really building coordinated planning partnerships, capacity building, and implementing really effective risk reduction measures. So this plan contains a risk assessment of the county's vulnerability to a wide variety of both natural, technological, and man-made hazards. And then we also included climate change, looking at increased climate risk due to many of those hazards. And then identifies a range of actions that we can take and projects for reducing the risk posed by those hazards. And as I said, this is a comprehensive update to the 2016 plan. So it really involved a full rewrite, reorganization of the plan. We added new risk assessments, new countywide problem statements, and mitigation actions, and then really went through a really wide community engagement process as well, including community forums, public presentations, a public survey. And that is really because it's really important to get the community's input on this plan, because that is the only way it will reflect the really broad and diverse priorities and vision of everyone in the community. So I am here to really encourage and promote the plan in order to get as much community input on the draft that's available now. And we are accepting comments really for the next month. And that plan is available on the OES websites. And we have a short link. So it's www.co.monterey.ca.us/2022-MJHMP. And yeah, we're just hoping to get as much involvement, as this is really a great opportunity to hear from the community.
Thanks very much, Laura. I mean, when you talk about a hazard mitigation plan, it sounds really big and complicated, but it really, if people take the time to read it, we sent it around to our county staff, and there were county staff who responded saying, wow, I had no idea how complicated disasters are and were and have been.
Yeah, it's certainly there's a lot of content in there, but it's definitely easy to navigate and has so much information from just really overview of the hazards to detailed on what really specific property and critical infrastructure that might be vulnerable.
So I have a question for you now, but it's not about the hazard mitigation plan, although we'll send people the link to that afterwards to make sure that they share that. This is about cold weather. Can you share any concerns that you might have as Monterey County is in a cold snap right now, and maybe some recommendations for people?
Certainly, yes. So definitely one of the easiest things to do is just keeping aware of the forecast. I know that seems silly, but that will keep everyone prepared to maybe adjust your schedule if you want to avoid being outside at the coldest parts of day, like in the morning, or to make sure you're just dressed properly for the weather. Definitely keeping pets indoors, and if they're inside, making sure they have access to things to keep them warm, unfrozen water. And there are a variety of steps that this might be a little too late to maybe, I guess you could still activate on now, but weatherproofing your home. So from kind of insulating exterior water lines, weather striping doors and windows, making sure that you have repaired any roof leaks or cleared trees that might fall on your home in a storm. And if you do have a fireplace or wood stove that you want to use for heating, definitely get that checked every year. Often your local fire department can inspect those. And keeping a small smoke detector or battery operated carbon monoxide detector can be really smart to keep nearby, just to make sure that you aren't exposing yourself to any additional risks from that heater. And for those, if you have a loved one or if you are a little bit older, Sometimes it's really good to keep a easy to read thermometer in your home. It is sometimes harder to sense changes in temperature at older ages, and that can help you avoid health problems associated with extreme cold. And I guess the other big recommendation would be to just have your car or vehicle ready in case you become stranded and it's really cold out. So making sure you have full tank of gas, and then putting generally emergency preparedness supplies in your car, which are useful for hazards beyond cold weather, but having first aid, maybe blankets for the cold, a radio, a little bit of food, water is a really great way to just be ready in case you're stranded and it's very cold out.
Thanks very much, Laura. Are there any other questions? Oh, well, yes, there are other questions. So occasionally, Laura, here's one for you. Occasionally we hear stories about some residents who use their barbecues, small barbecues, to warm their garage or their rooms in their home. What are concerns with that?
Yeah, I do think that could be concerning, especially for carbon monoxide or letting too many dangerous chemicals into your home. So I would probably recommend in general and advise against doing that. But if you were pursuing that, certainly making sure you have really good ventilation and all your windows and doors open, which I'm guessing is the opposite reason you brought the barbecue inside, and maybe having something like a carbon monoxide or smoke detector. But generally, I would advise against using a barbecue for heating your home.
All right. Any other questions for Laura before we let her go for the day? Seeing none, thanks very much, Laura. Thanks for taking some additional questions about our cold weather as well.
Yes, of course. Thank you so much.
And now we're going to move on to the topic of the 2022 recovery run. And Dr. Casey Grover is with us. He's the chair of the Division of Emergency Medicine at Community Hospital. But today he is with us as a local physician with the Prescribed Safe Initiative to talk about the recovery run. Good afternoon, Dr. Grover.
Good afternoon. Thanks for having me.
Thanks for joining us. Tell us a little bit more about the run and why it is important.
So trying to keep away from the doom and gloom I think we all feel in 2022. Certainly people have talked about the twindemic of addiction in America getting worse during the COVID pandemic. And as an example, unfortunately, between April 2020 and April 2021 was the most fatal time in American history from drug overdoses, with 100,000 deaths approximately. And so we're seeing both nationally and locally here in Monterey County that addiction is really on the rise. And with that, we are continuing our efforts with our coalition, the Monterey County Prescribed Safe Initiative, to really try to provide healthy options to our community as far as healthy lifestyle strategies, and then really support our recovery community, meaning people that are in recovery, people that are currently suffering from a substance use disorder and trying to get treatment, and just in general, the people and families in our community that have to deal with the repercussions of a substance use disorder. So we began in 2020 with a run walk designed to raise awareness about addiction, promote exercise as a healthy life strategy, which actually can be very helpful in the treatment for addiction, to raise funding for those who need treatment for addiction, and then also to really celebrate those in recovery. And this will be our third annual event, and it is being hosted by our local treatment program, Valley Health Associates. Valley Health Associates is located in Salinas. They offer a multitude of services. Unfortunately, Valley Health Associates was busy today, so I'm presenting on their behalf. But we're very excited, as you heard from Christy, and kudos in the meantime to Christy for all of her outstanding work with COVID. But as you heard from Christy, our numbers are going in the right direction. And what we're seeing at CHOMP is certainly that our test positivity rates are drastically declining. And this will be an outdoor 5K event, on March 5th, where we will be having a run walk at the VA parking lot. Will be where we start. We'll be on Fort Ord Dune State Park. There will be some beautiful ocean views as we have this event to support our recovery community. And you're probably thinking about COVID safety strategies. So I'm an emergency physician. I've been dealing with this with Christy and the other county partners. We're going to just kind of take it day by day between now and March 5th as to what we think is the most appropriate safety strategy. We'll have safety protocols in place. We'll make sure that masking is used where appropriate. And then obviously it's an outdoor event, which really significantly reduces the risk of any significant spread of COVID. And in addition, the kind of the incidence of COVID in the community is anticipated to be pretty minimal at that time based on the trajectories of what's going on. So we are very excited to be able to share this event and look forward to being able to have another event to really highlight both the suffering that people with substance use disorders go through, but also the really incredible journey that people go through on the way to recovery. And I'll share just one brief moment before I open things up for questions. In the 2020 event, we actually had a young man who had been in recovery from an addiction to various substances for 90 days, and he won first place in his age group. And I still get goosebumps when I think about him on the first place podium stand cheering for his own recovery and to celebrate his accomplishments. And just, it was the most unbelievable thing to see someone like that make such a transition and be able to celebrate. And then the other thing, as we're learning more about brain chemistry, addiction can be really helpful in the recovery process from addiction. So we want to start getting people moving in a helpful way.
It's great to celebrate. It sounds like we're not celebrating the problem. We're really celebrating the recovery by running and everybody coming together and being very supportive. Are there any questions for Dr. Grover about the run or perhaps any of his work with the Prescribe Safe program? I think people are hurrying to sign up.
I did put the link in the chat for everyone, that is the link to sign up. And we certainly appreciate just the time to be able to get to present our work. And yes, just to be very clear, while it is a very dire circumstance nationally and locally with addiction, this represents one of our many efforts to try to provide some solutions and to really celebrate how wonderful recovery can be. And I know for me, I think my mental health has certainly been very challenging over the last 2 years. I just got back from a run myself, and exercise has really helped me to stay positive and focused. And I look forward to sharing that with others.
Thank you very much for sharing with us about the recovery run, and best of luck. We hope you get a lot of people out there running.
Thank you.
Thank you. All right, so for our final topic, we're going to take a new view, and for many of you who don't know the program, look at Monterey County's Nurse Family Partnership. This is a program that has been around for several years, and it is aimed at first-time mothers. Specially trained nurses regularly visit these first-time moms, starting very early in their pregnancy. The program has thrived during the pandemic, where even having to go virtually, and some of the first, they graduated a cohort of moms in the program. So we're very pleased to have some of the public health nurses here to talk about the program. Just to note, the presentation that they're going to give you is very thorough and interesting. It'll take about 10 minutes, but then we'll have questions for them afterwards. And many of our speakers to the program are bilingual. So if you have questions that you want to ask in Spanish, you'll be free to do that. So we're going to get started. We have Zanelle Cantu. She's the supervising public health nurse who's going to start us off, but also joining her are Dolores Moreno and Bonnie Hill, also public health nurses. Hello, everyone.
Hello, how are you? Thank you, Maya, for this invitation. And I'm happy to have Dolores Moreno, who is a nurse in the program, and she works, her area to see clients is in South Monterey County. And then I also have Bonnie Hill, who is another nurse in Nurse Family Partnership. And I'm going to begin my presentation. And thank you. My name is Zonelle Cantu. I'm a supervising public health nurse with the Monterey County Health Department. And today I'm going to talk to you about a program called Nurse Family Partnership.
So Zanelle, we're seeing your calendar right now.
Okay. Good job. Okay.
You're busy.
Hold on. Okay, hold on.
Perfect.
How's that? Okay, I got messed up on my monitors. Okay, all right. So I'm going to be talking about nurse-family partnership this afternoon, and I'm going to be starting with a little video.
When I found out I was pregnant, it was the summer before 12th grade. I was so scared.
It was really difficult not having my mom, my dad. As an immigrant, I didn't know how things were working here.
I was at rock bottom and I found out I was pregnant. I want better for myself and better for my life and his life.
Prenatal and infant and toddler development may be the most opportune time to make lifelong effects on human development and health.
Nurse-family partnerships intervention offers a multi-generational effect. Strong moms raise strong children become strong parents.
With nurse-family partnership, we support families in meeting their health and wellness goals for their physical health, but also what it means to be a healthy family.
When a mom has confidence in herself and her abilities, she's going to translate that down to her child. It's going to allow her to work with her child throughout many years as they deal with other challenges that they're going to come up against. When you talk with our moms, most often they have challenges such as homelessness, addiction, they're socially isolated, and that's where nurse-family partnership comes in.
No solamente la palabra, sino en todos idiomas.
I feel like I'm the support for them, but they're learning themselves, and it's amazing how they learn that they have the power, that they're powerful.
I was in a very bad spot when I found out I was pregnant. I was getting high. I was very nervous and scared. And then I finally sat down and thought, and I went to John Brooks Recovery Center and I got put on methadone.
It's very common when somebody's going through addiction to have some type of trauma, something that happened in their life that they are trying to cover their pain with their addiction. So I helped her with resources to start counseling.
Dawn helped me with everything, learning how to take care of his needs and take care of mine at the same time.
James is a very happy, alert baby. His development is right on track. Now he's already attempting to try to crawl. He's a gorgeous baby.
Katie has helped me with a lot, and I think she might be my biggest supporter, honestly.
With Vicky, I feel she replaced not having a family. She feels like family. She is family now.
She's always there. It's not just for the nurse part. She's there for everything.
I can't imagine having done all of this without having been in the program.
We see long-term effects of the intervention and outcomes that are of unquestionable public health and social importance. Since 1996, we've reached over 269,000 families. If you can change a family, you know you can change a community.
We're at this point right now where we have the opportunity to really scale up based on 40 years of success. We're going to reach the scale that's going to make a real impact in this country.
I want to just be the best mother I can be. I know there's going to be challenges, but I'm okay and ready for that.
The goals of nurse-family partnership are to improve pregnancy outcomes, to improve child health and development, and to improve the economic self-sufficiency of the family. And this is done in a few ways. Nurse-family partnership is a nurse case management program. Registered nurses who are public health nurses are specially trained in the nurse-family partnership model. It is a proven program. It is evidence-based and it is extensive and compelling. It's also an intensive program. First-time mothers are provided services early on in their pregnancy, and continue with the program until the child is age 2. It is also very timely because we are involved in the first 1,000 days of human life. The first 1,000 days of human life is very significant because we have a rapid growth of the developing brain. We know that chronic stress can lead to toxic effects of the developing brain, and also this can lead to lifelong problems. However, we also know that early intervention can prevent some of these negative consequences. And this can be prevented by providing a stable and caring relationship. And this relationship that I'm talking about is a relationship between a mother and her child. And this is essentially the heart of nurse-family partnership, is to support the attachment and the relationship of a mother and her child. And if you look at this picture graph that I have here, you can see that this is of the first 1,000 days. And we can see in the red, pink, and blue the rapid development of the brain in sensory pathways. I'm talking about vision and hearing, language, and higher cognitive function. And this gray rectangle is this area or is the time that nurse-family partnership is providing services during the critical first 1,000 days of human development. Nurse-family partnership was started in the 1970s by Dr. David Olds and has 3 significant research trials that were completed. The trial outcomes are, again, very significant. I'll let you take a look at what they are. I'll highlight the first one, 48% reduction in child abuse and neglect. Locally, I'd like to talk about some of the accomplishments of nurse-family partnership in Monterey County. I currently have 4 nurse home visitors that cover all parts of Monterey County. In January of this year, we marked our 3rd year anniversary of nurse-family partnership in Monterey County. Also in 2021, we graduated our first cohort of NFP clients. In 2021, we also expanded services to South Monterey County with the goals of reaching first-time mothers that are Spanish speakers, that work in the fields or that work in agriculture, and also first-time mothers from indigenous communities. And then additionally, we have this wonderful collaboration with Monterey County Behavioral Health to increase mothers who are in the program and who are experiencing anxiety, depression, stress, or trauma. The eligibility of nurse-family partnership is that you need to be a Monterey County resident, you need to be low income, and this is defined as eligibility or eligible for Medi-Cal or WIC. You need to be a first-time mother, and you need to be pregnant at 28 weeks or less in your pregnancy. And this concludes my presentation. Thank you, Maya.
Thank you very much for sharing about the program. If you would, if people have questions for Zanelle or any of our other public health nurses, please feel free to put them in chat. Zanelle, I'm wondering if you could talk about the graduation and a little bit about the parents who went through the program.
Yes, so the graduation, we had 11 graduates from our first graduating class, and we had to be a little bit creative because it was the pandemic. So instead of having a ceremony, we did do kind of like distance visits with them. They received a certificate. they received some, we call it NFP kind of swag. So they receive recognition. They also have the opportunity to, we kind of would like to grow our own in the sense, there is a Nurse Family Partnership alumni. And so we are also reaching out and trying to grow that for our own Monterey County moms that have been through the program. A lot of our moms are do work in our Spanish speakers, not just in South County, but they also work in the fields as well. Let's see, a lot of our moms are young. Some of them are teen parents. They're a good fit. We have some moms that are on probation. A lot of our referrals come from WIC, so we have a very close collaboration with WIC, and we're grateful for that. Yeah, and I would say that we're very happy that we can provide the support for the behavioral health or mental health support for our moms, because maternal mental health is, the importance of maternal mental health is becoming, more awareness is becoming towards that. And so we're very happy to support the first-time mothers who are going through anxiety and distress or trauma. And we've also learned that being pregnant is a very tremendous time of change, especially when you're going to be a mother for the first time. And it can bring up a lot of, it can bring up past traumas and things during that time of your pregnancy and postpartum. And so we're very grateful that we can support the mothers with that in our collaboration with the behavioral health.
So Zanel, I do have two questions for you. One, I was hoping you might talk about how someone gets into this program. And then I'm wondering if one of our other public health nurses could also share how to connect with the program in Spanish for people who may be more comfortable hearing it that way.
Yes, so we do have a referral form that people can, so you can self-refer. This is not, you don't need a doctor's order or anything like that for this program. It's voluntary, and we very much encourage self-referrals. So a mom can refer herself, and we do actually get quite a few self-referrals. But you can, it's a variety of ways. You can call me, you can speak to one of the nurses, but we do have a referral form that can be faxed or emailed.
So how would they get, is there an email, a phone number? What phone number can we give them?
Yes, we can, maybe Ella can kind of help me with that. Ella Harris is here. She's my supervisor, and we can put we can put some information in the chat for that. Yes.
Okay, super. And there it is in the chat, and I'll go ahead and share that online as well as with our media partners about referral. And then if one of the one of the other public health nurses could share this information in Spanish.
Dolores, do you want to help out with that, please?
Yes. Do you want me to speak Spanish in Spanish?
Yes, please.
Claro. Gracias por la oportunidad de estar aquí. Es un placer trabajar para este programa de Nurse Family Partnership, que invitamos a todas las mamás que están embarazadas la primera vez, o si han tenido abortos o si han perdido los niños, por igual pueden calificar el programa. Tiene que estar embarazadas 28 semanas o menos, y también pueden referirse ustedes solas, o pueden algunas amigas también, si conocen que están embarazadas, las pueden referir. La información la está poniendo él en el chat, entonces la pueden compartir allí y mandar a las mamás. Es bello que aunque al principio las mamás están como, y eso es mucho tiempo, los 2 años, ¿no? El embarazo y 2 años, pero empezamos a hablar un poquito de darnos la oportunidad de hacer unas cuantas visitas, ver cómo el programa trabaja, porque no es un programa muy común, no es regular, porque hablamos en todos los aspectos de la persona, especialmente las hormonas, de que sabemos que dentro del embarazo causa muchas aspectos en la vida, emocional, mental, y hablamos espiritualmente, no de religión, sino una fuerza aspecto de qué es la fe o la espiritualidad de la persona, que le ayuda dentro de las visitas, dentro del embarazo, dentro de lo que estamos pasando del COVID, a cómo ser la mejor mamá que se han dispuesto a hacer, que siempre es lo que una de las metas dentro del programa, cuando dicen, ¿cuál es tu meta? Quiero ser la mejor mamá, ¿no? Entonces de allí arrancamos a qué es lo que quieren, qué es lo que pueden identificar ellos como una mamá perfecta. Y entonces, así que invitamos que nos manden a las mamás, necesitamos mamás, y estamos aquí para servirles con mucho cariño.
Thank you very much for that. And then for the phone number, we do have a phone number here. Besides the link, the phone number for the office is 831-755-4950 if people want to call and find out about the program or get the form to do a referral. All right, thank you. I don't have any questions. For you. Thank you all for sharing about the program. It's so exciting to have a graduating class of these moms who can then fan out this information to their friends, other people that they know, and be your best champions for the program. And that will wrap up our briefing for today. Thanks everyone for being on. Our next briefing is next week, and we'll see you then.
Thank you, Maya. Bye.
Bye, everyone.